All right, we're here today with Jim, and Jim is about to start his treatment with Dr. Davis. So, Jim, tell me, how long have you had the shoulder pain?
About 4 or 5 years.
Okay, was it due to an injury, or you just kind of woke up that day, one day like that, or?
Well, it just kind of happened probably from overuse of different sports.
Okay. Have you seen any other doctors for this?
Yes, I saw my regular doctor.
Your family doctor.
Yeah, when the pain would be unbearable, and he'd give me some pain medication.
And he also gave you some physical therapy, correct?
He sent me to a physical therapist, yes.
And how did that work out for you?
That worked out where I got a little bit of range of motion back.
Okay. All right, but you're here today to get it taken care of. So, what is this holding you back from doing? I know you mentioned sports. What kind of sports do you like to?
Well, I like to play racquetball.
So that's a lot of movement with the arm.
Yeah, and that's my right arm. And then the other thing's fishing. I like to fish.
Absolutely.
Overhead casting.
Yeah, that's what causes the pain and yeah. Okay, so Jim, I'm going to have you do a couple different exercises with me. So with your hands down to your side, how high can you raise your arms up on the side? Okay. All right. Now, Jim, the next thing I'm going to have you do is arms up at a 90-degree angle. And then I'm going to have you rotate up. All right. Arms back down. Now, Jim, if you'll turn around for me. With your good arm, how high will your good arm go up your back? Okay. Now with your bad arm. Okay. Yeah, we got some work to do. That's for sure.
That hurts.
That hurts. And speaking of hurt, you said your pain level today is
I'd say a 5.
It's a 5? All right. Well, let's get you started. Let's get you feeling better, okay?
Okay.
All right.